is Dr. Praveen Ramachandra from Arka Hospital, Bangalore. As we know that ICM has released a Mylan COVISELF COVID-19 Rapid Antigen Test Kit, in which any person can do themselves the test, and they can know whether they're COVID-19 infected or not within 20 minutes. It's a very welcome test step, because anybody who has symptoms now can, even in their own home, they can test and they can take appropriate medicine and action. Till now, what used to happen is many people who are, although having symptoms, used to not do the test, so we were not knowing about the exact extent of this infection, how much it has spread and who has got infected. So since it's a home based and self-serving test, self-doing test, so many people can now be diagnosed that whether they are infected or not. That's a very welcome step, and this is going to be commercially released in some time. And the Mylan company has released, circulated some video how one person can themselves do the test, what are the steps, how to interpret, and how the mobile app can be downloaded and report can be updated. All those things have been circulated. So if the self-explanatory, you can go through that video and it can be done. Slightly technical, so many people may not be able to do it properly. So there is a term like false negative test can occur in this patient because if they don't do well. What is false negative test? Meaning the patient can be, or person can be infected with COVID-19 virus, but the report can come as negative. So what we call in medical places is a false negative test. So what are the reasons? If you don't take the sample properly and if you don't take the adequate sample, so there's a procedure how much inside you have to put the probe in your nose. If you don't do all this properly, so less load of viral sample will be taken, that it can come negative. And the disease per se is so mild that at the time when you do the test, that the viral load is not much, so that also comes as a negative. And if you don't mix with the reagent properly, that also can lead rise to false negative test. Another aspect is, since it is a home-based test, what we are finding is after doing the test, they give a biohazard package where you have to put all the component of the test back into the plastic pouch and seal it. But nobody has told, or there is no information in the public domain that how this biohazard pouch will be discarded or the waste will be collected. Because apart from the diagnostic centers and clinics and medical hospitals, there is no mechanism to collect biohazard waste. Because if the patient is positive, that whatever the test material is there, that will get infected, contaminated with COVID-19, and that can cause, that will be potentially infectious to other people, especially BPM workers or the people who come to collect the waste from the household waste. So this biohazard should not be mixed with the household waste and discarded. So right now we don't have information how this biohazard waste will be handled by the government.